announcements. I'll introduce our trainer very quickly and let her get started. So Dr. Tanya Phillips holds PhD, LCSWC, LCADC. So we have a very qualified trainer, and we're very grateful to have her with us today. Dr. Phillips owns a consulting company called Team Phillips Consulting Group, and it's through that service that she's providing training for us. She's done one other training, and we have another training coming up June 19th through BHSB, so we thank her. She has worked for over 10 years at the U.S. Department of Defense, the Army Medical Department. She is a social worker and is also now supervisor of social work department. She has taught at Morgan State, Coppin State in their social work departments and has done other presentations and trainings. So I'll stop there and I'll ask Dr. Phillips to, again, if you haven't already, unmute your phone. I know you're going to be talking about PowerPoint and whatnot, and I will be here, but I'll mute my line. Thank you.
Right. Thank you, Bonnie. Hello, friends, colleagues, and all that I have not met. Thank you all so much for having me. Thank you, BHSB, for this opportunity. What we are talking about for our short time together today is the ethics associated with telehealth and telebehavioral health in particular. I guess about 60 days ago, probably a little over 60 days ago, we got just busted into a new way of delivering services. I see smiles and head nods. Am I the only one? So with that, although behavioral health teletherapy has been around for a really long time, many of us had not been forced or had not had opportunity to use that platform. So the why behind this training today is really just to look at what are the ethics behind virtual delivery of services. Are there differences between a face-to-face contact and a virtual contact, and what is required of me ethically to maintain the ethics behind my profession? So what I thought we would do today, because I have so many people here in a short time, I want to go through the presentation, and it's a short presentation, because none of this information, honestly, is going to be foreign. It's kind of just going to be a reminder of what our ethical framework is for providing services. But what I would like to do is save some time for Q&A. There is a comment box. If you have comments, questions, or concerns, throw them in there. And if there is any need for interaction, or you have burning questions or burning desires or thoughts, I'm watching, well, I can't see your face once I share my screen, but go on and unmute and jump in. We're going to be immensely informal, because if anybody is home like me, I've been really trying to navigate what we do now. I think it's important now than ever that we find ourselves a community, our communal support. So I don't want to be formal. I want you all to ask questions as you need. I'm going to begin sharing my slides, which means, okay. Can you all see my screen? I think it's there.
No, not yet. Did you?
Wait a minute. What did I do?
Take your time. Hover in the center of the Teams meeting till you see the box with the up arrow. Hit share.
I don't know how I got so big into my PowerPoint without being able to share it.
Can you go back to the Teams meeting with the faces, everybody's face?
Here, and I'm seeing share.
And you click it.
Well, where's my slide?
Is there a choice? Oh, here we might. Okay, there you go, dear. And you need to make it big. There you go. We're good now.
All right.
Just if you could do the screen. There you go.
There it is. Can you all see that?
Yes.
All right. I can't see you all, but I'm guessing that you can still see me. Okay, so this is the interactive webinar today, Behavioral Health Ethics for Telehealth Services. As we have talked about, we'll spend a great deal of time looking at what's required of us in a virtual platform providing services to our consumers. Quick disclaimer statement. Bonnie talked a lot about who I am and where I work. However, I wanted to be clear that this webinar is a direct collaboration between myself as CEO of Team Phillips Consulting Group and BHSB. For the purposes of this webinar, I am not representing or associated with any other outside entity that I may have affiliations or credentialing with. All right, so here we are into our presentation, Behavioral Health Ethics, as we stated, for telehealth services. I did a word cloud just to kind of focus on some of the prominent words that may be associated with ethics and how easily these words can be forgotten in our day-to-day interactions with in professional capacities. The highlight, the big one that I thought, well, all of them are big, but the highlight in this word cloud here is health, safety, confidentiality, and then the client. Everything that we do in our behavioral health code of ethics for care provision should be patient, client-centered, and best practice for the client. And then maintaining a confidential base where we are protecting and providing safe services for those that we serve. Now, just a disclaimer again, in light of COVID, many of the federal and state agencies kind of released a lot of the HIPAA compliance restrictions in an effort to, again, be client-centered. Several of the platforms and things that were norms prior to COVID-19 loosened just so that we could still be able to provide a service to our clients. I want to provide a disclaimer there, although they are still up and able and saying, hey, you can see your patient via Skype or FaceTime or whatever you need to do to get the client met. I would encourage you all, agencies in particular, to begin to develop protocols for HIPAA compliant platforms where we can still maintain our code of ethics and avoid some of the words that you'll see up in this word cloud, breaches of confidentiality, privacy, and things like that. So we will spend some time in this webinar today really looking at what we are doing as a profession, as behavioral health providers, to ensure that our clients' needs are met, our care is patient-centered, but we are still maintaining the ethical framework of which our professions are built. So the objectives associated with this webinar and our time together are noted here. By the end of this webinar, participants will be able to demonstrate knowledge of ethical principles as they relate to telehealth services and professional obligations to our clients. You'll notice a lot, I'll speak about client-centered practice. Again, as our ethical code requires us, our work should be totally focused in ensuring that we're providing care for our clients. Participants will be able to engage in a dialogue discussion where we're examining our professional ethical code of conduct for telehealth. Participants will be able to understand skills to protect consumer confidentiality during telehealth services. And then the final objective is to be able to identify ethical dilemmas in telehealth service delivery in light of COVID-19 and strategies to address these dilemmas. So I am a very interactive engagement, which kind of makes it difficult on a webinar, but I want us to be able to have some dialogue, even if it's your own personal experiences with delivering healthcare services via new platforms and ethical dilemmas or ethical concerns as they may have presented. So here's the why slide, right? And this is kind of where I want to prick your brains and have you all start thinking about your own code of ethics. You know, why do you think we have an ethical code for telehealth practice, right? What was the thought behind that? Why is that even necessary? Why do you think, what do you think are some of the differences or similarities between face-to-face and virtual encounters? All right, am I required to present myself differently, or is there kind of the same ideas about service delivery virtually in the comforts of my own home or the comforts of wherever I may be delivering the service away from my person that I'm working with? Is there something different required of me? And then what is our ethical responsibility to our clients in, during, and after a pandemic? All right, as I stated when I started opening up, talking about 60 days ago, and I'll actually go further than 60, 90 days ago, we really were not thinking that this was going to be our reality today. So 90 days ago, we may have just been doing what we normally do, and then suddenly things changed. Do I still have an ethical responsibility to ensure that I'm taking care of my client during, or my consumer during the pandemic? So those are the dialogue questions that I want us to dive back into after I go through the slides. Here are a few definitions just for clarity to be sure that we all are speaking the same language. Ethics are those professional principles and behaviors that govern what we do, right? They're the bedrock of our practice and how we interact. The ethics is what makes our professional practice different from personal encounters or personal relationships that we may have with people we like or dislike. But our ethics is what guides behavior, and it gives us a framework and a guideline and a kind of a blueprint of where to go for when we have dilemmas or where we may not know what to do. Teletherapy is defined by the use of interactive audio, video, or other telecommunications or electronic media to deliver behavioral health services at a location. Key part about the teletherapy, it's a location other than that of the client. So if the client is home and I am in the office, or the client is wherever and I am in a different location, there is teletherapy. Synchronous, simultaneous conversations between two or more individuals. So again, it's video contact where, not a text message, but video where we are simultaneously speaking back and forth, similar to what we're doing right now. The exclusions, as I stated, the federal and state guidelines have made some provisions for the exclusions, but exclusions of what teletherapy is not: an audio-only telephone conversation between a counselor or therapist or a provider and a client. Prior to COVID-19, most ethical guidelines for the state of Maryland, I'm looking at the social work examiners or Board of Professional Counselor examiners. Audio telephone conversations were not included in what they considered teletherapy. However, with the emergency processes that were needed to accommodate client-patient care, COVID-19 inclusion included some audio telephone conversation immediately. Electronic mail message between a counselor, therapist, and a client is not considered teletherapy. A fax or a text message or other type of message sent between a counselor, provider, and a client via short message service or multimedia messaging service is not considered teletherapy or a billable service. Just to highlight some of our ethical framework, I think at the pitfall, and I've been saying it from the very beginning, the very top key ethical principle that we have is a service to clients. In light of COVID-19, I'm not sure about you all, but thinking about working from home, parenting from home, being a therapist from home, being a school teacher from home, all the mighty hats that I had to carry kind of seemed heavy. But and I thought back into my ethical framework, I could not just abandon my clients, right? So the idea of teletherapy was the only way if we were going to stay in consistent compliance with the social distancing, isolation, and quarantine guidelines that states issued. Then teletherapy made sense in terms of being able to provide a service to our clients. In our ethical frame to make sure that we're taking care of our clientele, our professional code of ethics calls for us to maintain a level of professionalism in our work with our clients. So at the forefront of all of your ethical principles and all of your ethical practices is the question, am I available to my clients? Does the teletherapy guideline or the teletherapy that I'm using Does it allow me to see my client, communicate with my client, be able to safely assess what's happening with my consumer that I'm working with? All of the ethical questions that we would ask about people or our work with the people that are sitting in front of us. From a telehealth perspective, we still have to maintain that as our number one priority is the service to our clients. Then we move into a safety realm, right? When people are sitting in front of us, it's easy to see them in distress. And if there are safety concerns, we know right there with them in front of us, we're able to call 911, get a supervisor, get whatever we need in place immediately in the presence of that person that we're working with. From a teletherapy frame, when we're thinking about safety concerns, it is important when you start your sessions with your whomever, your consumer or whomever, that you know where they are. You know who else is there. Is it a safe environment? Do you have a space in place where we can speak safely and you can be transparent in communicating what's happening with you or what's going on with you? And if I needed to create safety protocols, emergency petition, 911, medical emergencies, can I send officials to where you are? All right, so when we're thinking about our ethical frame, and I labeled them not necessarily in order of importance, but more predominantly in order of ensuring that we are still, from a teletherapy perspective, in a pandemic or wherever we are still in ethical alignment with what our requirements as professionals are to the consumers that we take care of. Informed consent. Clearly, this was a difficult thing to do in the, again, with the quickness and the rapid transition from face-to-face to teletherapy. However, we still are ethically bound to get informed consent from the people that we work with about transitioning from a face-to-face encounter to a teletherapy encounter, with full disclaimer and disclosure of what the limits of protections of confidentiality are. For example, with the loosening of the HIPAA guidelines and saying that, hey, I can see my people on Skype, or I can see them on Zoom, or I can see them wherever, just so that I can still ensure a service to the client. It is important in informed consent that we're saying to the client, all right, that this is not necessarily a HIPAA compliant platform, or this is a HIPAA compliant platform. And for that reason, there may be limitations to protecting your confidentiality or privacy concerns. All right, but informed consent is the bedrock of what we do. Even in the middle of a crisis and pandemic, we still have to maintain our ethical balance and our ethical code of operations. Then, of course, confidentiality. I can't tell you how many people I've been scratching my head about. I know we are working from home, but it's really important that we're still protecting classified data, and that could be records, communications with patients, patients' names, date of birth, any PI information that we have about our patients. We can't just have it scrolled across our kitchen table with our families still just in the midst of our workspaces. And I do understand how immensely difficult that is, with home being work, play, and everything. But we as the professionals still have a privilege and a right that we have to protect the confidentiality of those that we're working with. So it's important from a telehealth frame that when you are working and doing your service to your clients in a platform from computer or telephone or wherever, that you have created a space where you can ensure that no distractions from your background are going to interfere with your encounter with your consumer, as well as from their end, that they can ensure that they have a confidential place to still continue in their encounter with you. And then the last one about ethical frame here is immensely important as well, competence. I don't know about everybody here, but I had not used Teams or Zoom or all of these other platforms that suddenly has been burst into our lives as much as I've used them in the last 60 days. It is immensely important to be able to deliver a service of quality to our clients, being that top frame of ours, that we understand how to use the technology, that we understand how to mute, how to open up, how to share a camera, and that we have the skills necessary to be able to provide the service to our client, not just from a technology base, but also anything new that may be presenting from a clinical frame or a clinical picture with your person that you are working with. Your duty to your client is to operate within your scope. Your duty to your profession is to operate within your scope. So we're talking competence on several layers here. Do I know how to use the technology? And am I skilled to deliver the service of what my patient, client, consumer is presenting with at this time? We know COVID changed an awful lot in terms of people's ability to cope and manage stress and all the changes in their lives. And we work with some of the most vulnerable people. We have the most vulnerable populations that we are providing service to. And if in our safety to our and service to our clients, we are discovering that new problems exist, and these new problems may be above and beyond our scope and our competence levels, we have an ethical obligation and an ethical duty to be able to get our consumers to the care that they need. This slide talks about standards of practice. Essentially, what do I do, right? As a telehealth consumer, as a telehealth provider working with my consumer, what does that session look like? What am I to do from beginning to end? I call the standards of practice kind of the go guide, right? This is what I need to ensure. These bullet points on this slide are minimal standards of ethical practice. So, of course, we have to verify that the patient is who we know they are to be, who we are supposed to be working with, especially those that are doing things telephonically. Verify the patient ID, ask for 2 identifiers, be it a date of birth, a social security number, or something to ensure that I have some PI to know that this is Joe Brown. Indeed. Informed consent, again, it should be a signed document that the agency has created, but at least be able to ask for permission. Are you agreeing to the informed consent of a virtual encounter with me? And ensure that they understand that that you have explained what the limitations of this, within this scope, what the limitations are. We have an obligation ethically to prevent a data breach to the best of our ability. In doing so, it's important to use HIPAA compliant platforms. I'm not soliciting which platform to use, but be sure to use a platform that offers a business associate agreement. That way that they are ensuring and supporting that prevention of data breaches and that things are safe. You have an obligation as a provider to secure a private location. And again, because we're working under extreme circumstances, whether that private location is your home with a door closed, the basement with the door closed, wherever, secure the private location as best as possible for yourself as well as the patient that you're working with. One of the questions that someone asked me previously when I had talked about this in another setting was if the person is not able to, if they live with multiple people and they're not able to have a secure private location, ask them, can they go to the bathroom? Can they go for a brief encounter to ensure safety? It may not be a long session as we normally would do in a face-to-face. However, we want to ensure that we are operating with a standard of practice in our delivery of care. Safety protocols at the beginning or somewhere throughout the encounter. Be sure to establish the to-dos if you're not safe. With an understanding, if you tell me that you're suicidal or homicidal, I am then ethically bound to send the police to your house to take you to the hospital. Or if somebody is abusing someone, I am responsible for X, Y, and Z. Establish the safety protocols with an agreement of who does what. If you're not feeling safe, can you call 911? If you're not feeling safe, who is in your safety plan that you are agreeing to contact and be a part of to include them in the wellness and safety for you and those in your care? Develop alternative contact. We know technology messes up. We saw that today when we started. The email link didn't work. We had to figure out something different. If there is a failure in our technology, how else can I call you? Do you have another computer? Can you use your smart device? How else can we connect? Because remember, at the top of my tree, a part of my tree is provision of care to my consumer. So I want to be sure that in the event things go left with our technology for whatever reason, we have an alternative plan where we can still continue our care. Again, a part of safety protocol, know the physical location of your client as best as possible. Safety protocols, if I need to send a team, if I need to send a crisis team, I need to send the police, I need to know where you are physically. Identify who is present as best as possible if the client has a space for privacy, right? If everybody's there, is there a better time for us to do this where you have a little more privacy? And again, how does the patient feel, the client-centered care? How does the client feel about who's in the house? Are people at the door listening while we're having this conversation? Are people eavesdropping and are, do you have space and time and safety for this type of care? And guys, I know this is a lot, but we have a heavy ethical obligation in our practice. We have to maintain the integrity of our profession. That's the final bullet, professional integrity. There is so much that encompasses that professional integrity. I speak about that totally, solely on the provider. You have the privilege, you are the professional in the space. When you have your teletherapy sessions, I'm not saying put on a 3-piece suit, but still get dressed. Don't deliver care in your pajamas or your rollers or your head still wrapped up. Or there is a difference between the care that I'm providing to my consumer and the girlfriend chat that I'm going to have on FaceTime with my girlfriend. So I would encourage you all to maintain the integrity of your profession. Treat your teletherapy sessions as though they are face-to-face encounters, because indeed they are. They hold the same ethical foundation and the same ethical practice in terms of representing yourself as a professional and then representing your profession and taking care of your patient or consumer. I can't see if anybody is commenting or asking me questions. Is everybody okay? Just doing a check-in. Any questions at all?
Yes.
Yes, ma'am. Everybody okay?
Yes.
Okay.
Dr. Phillips, this is Bonnie.
Yes.
There was a question about 15 minutes ago. It's in the chat box. It says, will audio be permitted post-pandemic? So I think that means audio only. I have many elderly or marginally, I have many elderly or marginalized patients who cannot access video technology. I have found maintaining contact with established patients to be extremely effective and ethical. Are there studies to defend the use of audio only post-pandemic?
This is a really good point. I think the pandemic has taught us some great lessons that is going to take some time for the boards to be able to come up to speed with what we're looking at, with what is happening and the quality of services that are still happening and the discoveries that we're finding in the middle of our professional code of conduct to our patients. So I do not have an answer for that, but I'm certain that that is something of many things that are going to be on the table with our professional organizations to make changes to what is already in existing. Because normal as we knew it or know it, it's a constant ever-changing dynamic. So that is something that is definitely noteworthy to elevate and take to our boards. And even from a micro perspective, I would be advocating whoever that is, I'm sorry, I can't see, to be able
to see. It's Anna Backus. Thank you for taking my question, because I work at the Hispanic clinic of Johns Hopkins Hospital. And this has been an absolutely overwhelming time for my clinic and me. and my patients. And I found that some that can only do audio, it's critical. It's really a lifeline. So I find it really difficult to understand why we can't advocate for it to be seen as an ongoing option. Also, because there's an equity issue. We talk about ethics. Many people don't have the bandwidth or even the technology to be seen on these platforms. I'm lucky enough to be able to use WhatsApp. It's not my favorite option, but I can do it. But I don't know if we're going to be able to use it afterwards. But I think that's one of those things. I think that if there's a way for the boards and the powers that be to ask us, the people, the actual practitioners and the patients, what has their experience been in terms of, I think that would be a really ethically critical question set.
I fully concur, and it's the voice of the people like us that's on the front line doing the work to be able to elevate these things, because we are, you are, and we are finding that things that we've never done before are giving us results. So this is a great research time for policy implementation and policy development. So indeed, that's something worthy of elevating.
Dr. Phillips, it's Bonnie again. We had another comment. Over the phone communication is permitted from Cigna and Medicaid insurances. So I don't know if Mr. Boland wants to open his microphone. And my question would be, are you saying that right now they're permitted by Cigna and Medicaid, or
yes,
after the pandemic, will they be permitted?
I'm not totally sure about after the pandemic, but I do know right now that we are using telehealth video conferencing for all of our patients, and that Cigna and Medicaid insurances only over the phone communication is permitted.
Yes.
It's not ideal, but it is permitted and it can be billed.
Yes. In the middle of the pandemic, and I put that on my slide, there's been several relaxing of what laws exist because of this pandemic around billable services with being able to reach our clients, because the whole code of ethics and conduct for us is the service to our clients. And with this, there were no laws to say, right, we had never been here, all right, to be able to have a policy to support what we do. So right now, absolutely, insurance companies are reimbursing. However, professional code of ethics has not developed any change to their policies as to date. Can we move? Everybody okay?
Yep.
All right, so code of conduct, same stuff we've been talking about, HIPAA compliant platforms, making sure your setting is safe and decent, privacy is allowed. I can't speak enough about assessment and documentation. I'm not sure with what your agency's requirements are about your documentation after an encounter. Most places usually stick with a 72-hour rule, a 3-day after the encounter with the patient, to ensure that your documentation is there. So you want to make sure that even though things are relaxed, we're still working from an ethical frame where we are assessing and documenting accurately. Professional demeanor, I talked a little about that, with maintaining and ensuring that I am still keeping a boundary and a balance with how I deliver my care in the middle of a pandemic that I myself may be living with some shared collective trauma or experiences as those that I am treating. With professional dress code, we talked about that. Get dressed, present yourself presentable as a professional, even in telehealth arenas. And then avoidance of dual relationships. We know that that's a code of ethics that we've always had to live by. However, in the middle of a pandemic, it's easy to share the experiences. I'm not sure about you all, but being home for me has been a challenge. Working from home has been a challenge. And it's easy sometimes to loosen ethical bearing and ethical balance. So avoid dual relationships as best as possible, in maintaining our code, our ethical code. I wanted to talk a little bit about ethical dilemmas, ethical obligations to our clients. And I pulled 3 from those value-based ethics that I talked about in duty to clients, competence, and confidentiality. We know an ethical dilemma is a situation in which a difficult choice has to be made between two courses of action, either of which entails transgressing one of the principles. So for our duty to clients, we started talking about this a little bit. What if teletherapy is not an option? What if the people that we're working with do not have access? Somebody talked to me earlier about working in marginalized communities where they may not have access, so I have to use the telephone. However, the code of ethics as it stands now says that a telephone conversation is not ethically grounds for treatment, right? What do we do there? Competence. What if I am unfamiliar with the use of technology, but I've been suddenly thrust into ensuring that I maintain the connections with my client, but I myself am not familiar with how to do this? And then confidentiality. Ethically speaking, what if my children and family is home and I have no place to safeguard confidentiality, but my agency or who I work with is mandating that I still see my clients? This is a discussion slide that I want us to be able to, I know we're running low, but I want us to be able to ponder, and just as my emoji in here is doing, ponder on what do I do about this? How do I move myself to a frame where I am still meeting the ethical obligation, but working through the dilemma? Does that make sense?
Yes.
So I am at the end of the slide. Wait a minute, somebody, how do I get you all back up? How do I get back up?
Dr. Phillips, it's Bonnie. You need to go back to your teams with your pictures.
I think I'm back.
There
All right.
you go.
I think I'm back. So, are there any questions in the we talked about that. So I want to hear from you all about the ethical dilemmas that was presented in the slide. What do you all think about that? If we have consumers that we still need to provide a service for, but they do not have access, how do we still provide our service to the people that rely on us to be able to take care of them?
And Dr. Phillips, let me remind you, people need to unmute.
Oh, yeah.
Unmute their microphone if they want to speak, or they could type in the chat box.
Thank you.
Here's the chat.
Did I get any? No.
Where is the chat box?
Utilize, that's not minimal. Lomax. Lomax said utilizing earphones by clients is helpful. So earphones to kind of cut down on some, to ensure some of the confidentiality is still met. Have you all run into any challenges with doing telehealth, forced telehealth, in light of COVID-19?
This is Bonnie again. I encourage everyone to please speak up. We are, this is a CEU event. We need some participation. Any suggestions, questions, comments? This is your time, please.
This is Donna.
Can
you hear me?
Yes.
Okay, so one of the things that I found kind of incredible is the use of a car. A lot of the people I work for work at construction sites or landscaping and whatnot. And so they can go to the privacy of the truck or the car. And that's actually a safer space for them to be than just walking around outside. I know you're supposed to be at home, but that's very unrealistic. If you've got a job, you're going to keep it. And so that's one of the things I've encouraged people to say, hey, well, when are you going to be alone in the car? If you're not going to be home, what else can we do? So that's one of the things that I've been able to do. Or sometimes well, what's your turn? What's your turn in the bathroom? Because a lot of my patients live in multiple family homes, and they don't have any private place to be except for the bathroom. So that's another. I've had very echoey encounters. Of course, they should be not doing anything else besides the telehealth visit. But that's one of the options I've kind of workarounds I've done.
I like it. I like it. I see another question here. Working with school age children who are in high volume households poses challenges. Indeed. Lomax, how have you worked around that?
Okay, well, one of the things that happens is, so I'm familiar with the families. We have, a pretty good relationship, so kind of able to have the clients get to as, I don't know, as less volume part of the household as possible to get the session done. But it does pose challenges because you have, multiple individuals in the household who at times does not respect all of the privacy that is involved because they are not in therapy. They're not informed. They may not be aware of, all of the confidentiality that surrounding the session. So, the challenges do, they're still there, Tom.
Mm-hmm. These are almost slipping back over into the ethical dilemmas of practice, right? How do we still maintain our code of ethics while understanding that the consumers that we're taking care of are smack in the middle of their environments, and their environments may not be conducive to what would be the privacy of our offices or our collective spaces that we normally bring them to for treatment. So I'll be the first to say that this has been challenging, and we're seeing some gains from it, right? In terms of being able to treat people in their environment and people not to miss time from work. There are several gains, but there are several ethical implications that are connected to this. And I think the why behind this webinar was just to ensure that we are doing our best, right, and with what we're giving to be able to provide a service to the consumers and the people that count on us for their mental health wellness. Additional questions, thoughts, or concerns?
I have one comment about kind of difficulty that I've had, but ways that I've worked around it. And then one additional challenge that I've had. But I work with a teenage boy, and he lives in a studio apartment with his grandmother and baby sister. So that can be very challenging. But what we've kind of worked around, like there are places he can go sometimes, but if that, like the hallway, but if that's not an option and, there are people around, he'll go into the bathroom, put on some headphones, and I say, if there's something you really want to make sure that your grandma doesn't hear, you can type it in like the chat feature, and we can talk about that. So that's worked pretty well for that particular client, but I don't know that it would work for every situation. And then a challenge I've come across is just the distractions that the kids have. Because it's harder to manage those when you're not in the room with them. I've had some kids kind of get distracted, and you can tell they're doing something else, and you're like, what's going on over there? But they're not always honest about it. So that's been a challenge that I've had.
How kind are you all being to yourselves in accepting that this change in delivery of care may mean that I have to adjust how I change and deliver the care? Are you all flexible with yourselves and maybe where before you were doing 45 to 55 to 60-minute encounters, are you all able to reduce those encounters to a 30-minute or to a 45-minute?
15, 45.
I think that in living with this, and this is certainly, I admit it, this is my first time living through anything like this in all my years of practice. But I think it's important for clinicians and providers to embrace, somebody said I'm embracing the challenge, I like it, to embrace the realities that we don't know how long this is going to be. All right, when we got notice about this a little over 60 days ago, I don't know, maybe it was me in an assumption mode that this is going to be short term. I did not think that 60 days later, almost 90 days, that this would be the way that I deliver therapeutic services. All right, I think in some of the adjustment and some of the changes, because the rules just keep changing, what hasn't changed is our ethical commitment to our clients. So holding and maintaining an ethical frame for how we do what we do is going to be quite essential. My outlook is this is sharpening tools in my toolbox.
Cool.
Yes, sir.
I'll call that back, please.
Very positive outlook. Because
I'll call that back, cool.
I do propose, and I see it happening, policies are going to have to shift. Right? Policies are going to have to shift. Insurance companies changed a lot of their policies immediately. Federal law changed immediately because we recognize that we have no other way of reaching. And if we had to guesstimate, we can say that in light of this, we're going to see an influx of our folks that need us more.
Well, Dr. Phillips and everybody, I mean, one of the things that I've had to confront is the ethics of having to do emergency petitions on the phone, or I went through an entire CPS reporting procedure on the phone where I even went in the police car by phone with the teenager to the hospital. And it was a kind of a bizarre situation, but it was as you say, kind of a learning opportunity. Because in fact, I think that would be a good thing to have instituted, to have a friendly person on the phone with a person when they're being transported to the hospital. And that had, you know, the person couldn't go to the hospital with the child, and she was very frightened. So the police officer said, hey, why don't you stay on the phone with her while I get her to Johns Hopkins? I'm like, brilliant, that sounds like a good idea. So, I mean, but I've had other situations where there's domestic violence, and I like the idea of like, I had to have them put it in a text message, like just text me or what's going on right now, and I had to actually intervene. So I think one of the things we have to also think that verbal doesn't mean just oral, it could be written at the same time. That's just my experience. I'd like to hear what other people do.
Thank you, Donna. You were
That was like a 3-hour telephone call, by the way, with CPS. I was like, wow, but it was well worth it because the kid's safe, everybody's safe.
Somebody here said code words for safety can help. And I think when we're talking about our obligation for informed consent and establishing the protocols of the session, the code word opportunity comes up in that educational opportunity to say, this is how we're going to do things. This is how we operate from here. But I think, you know, you guys, from what I'm hearing, you guys are killing it, right? You're doing the work within an ethical frame. One of the questions that I posed early in the presentation was, do you all believe that our ethics are different, teletherapy versus face-to-face? Is there a difference? I say, unmute yourself, I can't hear. Who says no? I can't, I see heads nodding.
No, I don't think so. I mean, I think your obligations are the same. How you operationalize them might be different. You know, how you implement it, but the same ethics. We might need to actually, I think that we need more ethics, more ethical interventions, because there's more to protect, because you can't have that immediacy. And I also think there needs to be more protections for workers, like do no harm kind of thing. Like, as you said, our competency, some people are really good at this, but I think that we have to be very careful that our boards and we're protected, that we're doing our best. And that we're given opportunities to be trained, and not opportunities after work, but during your work hours. If you're asking us to work like this, then they should be able to give us the time during work hours to get, to build and practice the competency and some skills.
I fully concur. I think this is, somebody said, Ms. Jacqueline said, there's more you have to consider. I concur. I think that the lessons learned, right? We're learning in the fire. I believe that we all are learning as we process and learning as we go. However, a good ethical framework, that's our bedrock, that's our engine, right? When we're thinking about safety and patient care, Ms. Donna, you're not thinking about, oh my God, I've been with this person for 2 hours, I need to hang up now. No, you're thinking about the safety and well-being of my client, right? There's the ethical frame for us that keeps us moving and pushing. But I do concur that there's going to be an awful lot eventually of broadening of the brush around ethical practices and being able to deliver care in a diverse way to the people, that the consumers that we have to take care of. All right, I think, is everybody okay? Any additional?
Yeah. This webinar.
Okay, Dr. Phillips, it's Bonnie. Everyone, Bonnie Campbell from BHSB. I think I'll close by saying that everyone will receive multiple emails, and they'll be coming from bhsbonline@gmail.com. The first thing you'll get is a sign out, quote, quote, email that asks you to confirm that you participated in the entire webinar. The next thing you'll get is an evaluation form, ask you to evaluate the content, the training, how this hour went for you. And then the third thing is your certificate. You'll get another email with your CEU certificate that you can either save or print, or print. And then the other item is for peer recovery specialists only. In that process, there'll be a post-test, and they need to score 80% or greater. And you get 2 chances to take that post-test and to pass. And you do have to pass the post-test to get a certificate. And I wonder if there's any final questions. Anybody wants to unmute themselves and ask any questions about CEUs before we hang up?
When will we expect these emails?
Probably within a week, maybe sooner. We're trying to get them out quickly, so you should see them within a week. There'll be there'll be a contact person's name and phone to email, to call if you have questions, and you can call us. And I want to thank everybody for the mix-up today of starting late and finishing a little late. To those of you who could stay past 2, thank you very much. Others will get the CEU to you today. It was not your fault that that mix-up happened with the link to the Teams meeting. Dr. Phillips, any final words?
I just want to, I typed it in the chat box, but I just want to encourage you all, and I'll call you all today the Baltimore Rock Stars, right? That is the new title that I'm giving you all, because it is immensely challenging to be a mental health provider in any day, but to be a mental health, substance abuse, or behavioral health provider in the middle of an uncertain time, in communities that are already having a bulk of challenges. I just want to clap for you all and encourage you all to stop and hug yourselves and breathe, because we have never experienced this. And it's really important that we have safe spaces such as this, just to be able to refresh, refine, and retune ourselves. So thank you all for being my colleagues. Thank you for taking care of some of the most critical things and critical spaces that no one may ever clap for. I clap for you today, and I salute you and thank you for your service. Thanks for having me.